Okay, thank you very much, everybody. We're going to move into our last session. I'm Jane Bertrand. I'm a faculty member at George Brown College, and I'm also an advisor to the Atkinson Foundation and Margaret and Wallace McCain Foundation. So seeing lots of cross synergies, lots of different energy, lots of different things coming together today. And I want to thank everybody who has organized this. Zenit, you've done an amazing job, and I don't think we can underestimate how much it takes. And we'll be hearing more about everybody else who has put this together. Right now, we are heading into a panel, our final panel, and we are going to focus on a discussion about local leadership and how important that is as we look forward and look towards an early childhood system in Ontario. We have the Charles Pascal, who I think has left, but his vision in the report put out for the Premier's report, Our Best Future in Mind, called on and recognized that we would need the local partners, the local governance partners to come together to make the whole 0 to 12 framework work. And the three components of that are central are the school boards, the local children's services that sit inside of municipalities, or in Ontario we call them consolidated municipal service managers, a mouthful, and of course public health units. So public health, children's services, and school boards are really the local governance, the leadership that we need to think about how they come together. This is the front line where the rubber hits the road, and that governance level in a province the size of Ontario is really important. So without going any further, we've got three leaders here today. We have Elaine Baxter-Trahair, who's here from Children's Services, General Director of Children's Services at the City of Toronto. We have Catherine Fife, who is the Executive Director.
No, President.
Sorry. See, I should have had my cheat sheet. I should have looked for it. I did have it all proper.
Could be the ED.
Okay. President of the Ontario School Board Association. And we have Ann Biscaro, who I know well, and I think her proper title is Director of Public Health in the Regional Municipality of Niagara.
Family Health.
Family Health. Okay, well, you know.
I could be in charge of all public health.
Okay. We're going to move on now to hear from people who are actually knowledgeable. And we're going to start with, Elaine is going to start and talk about the municipal role. And I'll pull up yours on top.
Thank you.
Make it go big. Okay. Use slideshow. There we are.
Thank you, Jane, and thank you very much for having me here today. It's great to get out of City Hall at this time of budgeting and cost reductions and everything else to focus on the big picture. So this is a great opportunity, and I'm happy to go through my presentation, and I'm sure at the end of the panel, Lorraine McLeod is here with me, and either of us would be happy to give you any more information or answer questions. Advancing the Child and Family Centre model is high on Toronto's agenda today. We see it as a vehicle to improve customer and client service and to advance service integration. These are priorities not only of the Children's Services Service Plan for the next 4 years, but also of our new council, which really has put a customer and client-focused lens on all of the services that we deliver. But as many of us in the room know, this is not new to us at all. While there is much work still to be done to truly integrate our services in accordance with child and family centres, it is grounded in with our best future in mind, Charles's report, as well as in our past successes. It reaches back to the Toronto First Duty, which was a model that demonstrated how existing childhood and family programs can be transformed into a system for children 0 to 6. It is with the lessons from First Duty that we move forward with our vision. In January of 2010, Toronto City Council unanimously endorsed the vision as outlined in Dr. Pascal's report, which included the development of child and family centres. With this endorsement, we in Children's Services have moved forward to begin development of outcome measures and sites of practice where we can begin to build an understanding of how the vision might look at the neighbourhood level. I'll speak specifically about the sites of practice later in the presentation. Before we get into the nuts and bolts of the initiatives that we are undertaking to move towards implementation, it is important to remind ourselves of the vision. In order to understand the divisions and the directions that the city has taken, it is important to remember that we are dealing with a holistic system. While children will move through different components of the system, as you see it on the screen, they will always remain part of the single whole. The system will build on goals and targets for quality, expansion, accessibility, and effective use of resources, and will work to achieve better outcomes for children and families, as well as for services and communities. Access and movement throughout the city from the perspective of the parent and the child, if we do our job correctly, should be invisible and seamless. The policies and expectations in this presentation have been established to help us move closer to the vision that you see on the screen. The first initiative that the city has undertaken and continues to develop over the past year, and it will likely take, as I would think, another 6 months to a year to complete, is the development of a child and family outcomes framework. Children's Services, together with a number of city partners, has developed a framework that will allow us to work towards a common set of outcomes for our children, families, and communities. This model positions the development of child and family centres as a strategy that, along with many other strategies, will achieve our desired outcomes. As service system manager, it is important that the city has a framework to guide its actions and decision-making as it relates to the development and delivery of programs and services and the allocation of resources. At a system level, this framework forms the basis on which we achieve an integrated child and family service. It is to be applied on a citywide basis, so not just to the programs in which Children's Services are involved with, to promote consistent measuring of impacts of public programs and services on both children and families. With a focus on outcome, the framework includes multidimensional levels. At the systems level, which you see at the bottom, we'll be looking at outcomes such as the health in the community, social inclusion, and cultural development. In the middle level, the services level, we'll be looking at access and equity, accountability, integration, quality of programs, and community and family engagement. And finally, at the child, family, and community level, we'll be looking at healthy development, economic security, safety, lifelong learning, and parenting with supports for parenting. And we'll really be developing outcome measures in each of those areas to determine where our programs are at the outset of this initiative and where we manage to move them to as we progress through integration and creation of CFCs. The second initiative that we're undertaking is a renewal of our networks within the City of Toronto. Many of you have probably seen this slide before. We have undertaken a couple of rounds of consultation and a fair bit of community engagement on how to restructure our network system. But it became pretty clear to us early on that effective and inclusive networks is critical to the success of service integration. The new network structure will be implemented in Toronto towards the end of this year. We're hoping for full implementation by the end of 2011. The city is made up of a citywide integrated steering committee that is comprised of decision makers and key leaders in the community. The Aboriginal and Francophone groups are illustrated by the circle that is around the integrated steering committee, and this is really to demonstrate that these communities spread throughout the city. We'll be clarifying how we engage with these communities and the structure based on feedback both from groups like yourselves as well from the communities themselves. Branching out of the central system, our central circle, we go to 4 sector components that make up the child and family system, and I'll talk a little bit about each of these in the next slides. And then finally, the outer circles are ad hoc groups that will be established as needed. There may be one to deal specifically with CFC development in a specific neighbourhood or community, and one that may also focus on research requirements. The other thing in the outer circles is many of the existing community networks. We definitely see an ongoing need for integrated multidisciplinary community networks really at the local level. This structure does not intend to replace or adjust what already exists. If a network exists locally and it's effective, we certainly look forward to working with it. If a community needs additional assistance in creating the network, then we'll certainly work with them in that regard also. But we do not want to reinvent the wheel. In terms of the Integrated Steering Committee, as I said, it's a group of leaders who will provide advice and guidance that will guide the design of a comprehensive child and family system by creating shared understanding, aligning resources, validating outcomes, identifying strategic drivers, and integrating policy. The membership I won't go through, you'll see it on the screen, and it's a mix of government and community representatives, and it will also include representation from the 4 system components that you saw in the earlier slide. Here we go. This slide illustrates very effectively how we propose to integrate from the 4 sector groups with the local community networks. In order to build an integrated system, there needs to be coordination at the sector level. We have proposed 4 sector-specific committees. Those are the colored ovals that you see on the screen. And I'll talk about them in a minute. And they are the vehicles that will transfer knowledge from the central steering committee to the local networks and back. So it's a two-way communication stream. Now to talk a little bit about the 4 sector committees that we're dealing with. The first is the health component and its mandate. And I should point out, each of these committees right now has an interim lead assigned to it and a small work group, and they've been charged to go out and refine terms of reference and discuss proposed membership. The health component will focus on planning, implementation, and integration of priority services that meet the healthy birth outcomes and developmental needs of children. Membership will certainly include public health, hospitals, family doctors, pediatricians, mental health experts, and other individuals from those fields. The second is the family support component, which is charged with planning and implementation and integration of the range of services that support parents and caregivers of children in their caregiving role. This group will include the Ontario Early Years Centre, Family Resource Program representatives, Parent Family Literacy Centre representatives, and other organizations like that. The third group is the Early Identification and Intervention component, which is the planning, implementation, and integration of access to identification and assessment services for all children, and referrals and intervention services for children with extra special needs. This would include resource and consultative support to childcare and early childhood programs, speech and language therapy services, occupational therapy, infant development programs, etc. And the final group is the early learning and care component, which will deal with planning, implementation, and integration of high-quality services where children's care and learning needs are met. So that essentially is the 4 groups. In terms of what we do next, as I said, we have 4 very small teams working on each of those. We do have an advisory committee that's helped guide this process, which includes representation from the city, the province, and various community groups. Once the terms of reference are finalized for the groups, that will come back to the advisory committee. We'll then agree on membership, a communication strategy, and we'll begin the implementation in October of this year. The final initiative that I want to talk about is the sites of practice that the city is launching. And there are really 3 initiatives underway at this point. You'll see them on the screen. The first site of practice is at O'Connor. The second will be at Regent Park. And the third one focuses on the Aboriginal community. This is essentially a feasibility study at this point, again, to address the fact that the community is spread throughout the city and not in a single geographic location. So the feasibility study is looking at how we can best create a site of practice for that community. The city has created a Child and Family Centre work group that's comprised of staff from Children's Services, Parks, Forestry, Recreation, Public Health, and Social Development, all divisions within the city that have large roles in the delivery of services to children, youth, and families. This committee is directed to explore the possibility of implementing demonstration or early leader sites. These sites will provide a Toronto lens, which will build the early learning system framework. Early leader sites will model program approaches, staff competency requirements, governance, and funding options. And they will also inform the development of a planning and outcome framework by which we will govern and evaluate the child and family center models. The O'Connor site is the first one that is up and running and the farthest along. It's portions of it are up and running. It's by no means a complete CFC at this point. You see the various agencies involved in the screen. And we do have an integrated staff team that includes community representatives that is meeting to look at how we can better integrate some of the services in that community, as well as to identify and address community service gaps. So some of the services we're looking at is childcare elect training, parent and child programs, literacy recreation programs, special need resources, and the list goes on. Employment support also, because again, this is to address broader family needs also. Here are some of the measures that we're using in terms of laying the framework for the O'Connor site. We've already at this point clearly defined the neighbourhood that we're serving. It's a 1.6 kilometre radius around the existing community centre. We're in the process of mapping the baseline services that currently exist and undertaking a community engagement strategy. So as I said, we're testing the neighbourhood. Elect training will be going on for the collaborative team that's working together to expand the project. We had our first community event last night. And we will be then integrating CFCs into our operating criteria, which is the tool we use to evaluate quality. We are looking at developing specific criteria to assess the effectiveness of CFCs. A similar process, beginning with baseline mapping, will start in Regent Park, likely in 2012, when the bare buildings component of the hubs are ready to get developed, or will be developed. And I think I will end it there and pass it over. Thank you very much.
Move right on to you. There.
Good afternoon. I'm delighted to be here. Thanks for inviting me. I'm going to speak specifically about two examples of work that we've undertaken in Niagara, public health in collaboration with our partners in our Best Start Early Years Niagara Planning Council table. The first one I wanted to talk about is our 18-month strategy work. And just to give you a little background, way back in 2005, there was an expert panel that came together and delivered some recommendations. And we in Niagara decided that we had good science, we had good intent, and we had good collaborations, and we might test this out. This was before fee codes for physicians, primary care providers. It was before clear implementation or policy guidelines, but sometimes you have to take a chance when you think you have good things lined up in your community. We were also blessed with Dr. Robin Williams, our medical officer of health, who had a lot of respect in our community. So the Well Baby Visit, or the 18-month strategy, it's called a couple of things. You'll hear it called Enhanced Well Baby Visit, is an attempt to really turn a checkup into a pivotal developmental assessment, and an intent to connect communities with primary care and primary care with community. So there were a couple of things that happened as a result of the expert panel. Certainly identification of some tools. One, a parent-delivered checklist. It's not a diagnostic tool. Many of you are probably familiar with the Nipissing tool. And the Rourke tool was identified as the tool for physicians or primary care. I'm going to use physicians, primary care providers interchangeably. I mean nurse practitioners, I mean healthcare professionals. I may say physician more than I should, or it's just easier to say, but we mean the whole system. So the work tool is a tool that was identified as best practice. It's a point-of-care tool. It's like what a pilot would use before they take off in the plane. You know, you got gas, you know where you're going, is your radar working? We know from the literature that when you have an evidence-based point-of-care tool, you do a better job. So I talked about the goals, and one of the goals of the 18-month enhanced well baby visit is to connect community with primary care. You will meet physicians and primary care providers who don't know anything about Ontario Early Years Centres, or don't know anything about quality childcare, or don't know anything about many services in the community. They're reluctant to refer their patients because they don't know if they're good quality, they don't know what they're going to get there, they don't know if they're going to hear back. So we decided that after trying a broad-based education format, that really maybe we needed to think about a different model. So we felt the 18-month point in time to be very pivotal for a whole variety of reasons. It is an artificial vertical slice, so I don't want you to think that we're doing everything at 18 months and nothing before. A lot of people think, well, 18 months is too late, but you can see on the screen some of the rationale for really sort of concentrating on getting one visit right, getting it right at 18 months, hoping for bleed backwards and forwards, for lack of a better analogy. I got to think of a better one than bleed, but you know what I mean. So we went to Niagara Falls, and there's a family health team there that's very academic, interested, did a presentation, and they enjoyed the presentation, and we had the right people around the table, and the whole practice was there, physicians, nurse practitioners, administrators, physiotherapists, nutritionists, you name it. But when we walked away and checked back with them, even though they were academic and well-intended and all that stuff, they said, this is really hard. We've got a lot of things going on. We've got a process here. We've got a diabetes initiative. So we thought, well, how about if we link up PHN in there and see what she can do for half a day a week for a period of time. So that was the hypothesis. So just very quickly, in terms of project design, we partnered very closely with our preschool speech initiative called SS Niagara in Niagara region because we wanted a strong literacy component to this project. And then the PHN was present in the practice. She met with each primary care provider, found out sort of how they functioned, what they needed. Some needed very little, some needed quite a bit from us. So it really spoke to the need for what we call physician detailing, primary care detailing. And I think that's true across many systems, to understand their business and not come in with something ready-made laid on. So emergent literacy was something we were very interested in promoting. Certainly we know that parents from the literature, when their doctor tells them something's important, they tend to do it. So we learned very quickly that we needed to be flexible, hands-on, that one-to-one detailing. An interesting thing we learned is that the PHN actually modeled information and a way of speaking to parents that some of the physicians, nurse practitioners, really didn't have a skill set around. The work tool is an evidence-based tool, but it has a point-of-care prompt that might say parenting, childcare, car seats. So without a knowledge base or a really comfort level of talking to, how's parenting going is a pretty loaded question when you have 65 people in your waiting room. And we learned, even though there wasn't a fee code for this yet, it really wasn't about the compensation for many of our physicians, primary care providers. It was about the worry of having those 64 people in your waiting room waiting for you. You eyeball the family, you think things are pretty good, the immunization happens, and they really, to protect the time and to provide them with the tools and information that they needed to have, and building of relationships was key. So communication was a barrier. They're busy people. They've got lots going on in that practice. We had to fool around with PHN, half-day blocked. It turned out we created a problem for parents because then they had fewer choices to come in to see the doctor because they were blocking a certain afternoon for the enhanced well baby visit that takes 20 to 30 minutes all in versus much shorter visits that had been happening. Knowledge levels, and I'm sure, as all of you know, complex referral systems. I can barely figure it out, and I've been at this, I think, 21 years. So anyway, so key benefits from this pilot were crossover of information was huge. So that link to public health, they were very interested in the parenting and the early years stuff. They were also interested in rabies and West Nile virus and why parents were refusing immunization and all kinds of stuff. So that was a very neat sort of byproduct. The collaboration between health and primary care and the broader community, much more comfortable making referrals. The parents loved it. They started to know about community resources, so it was good. We did, you can see that this is a bit older, but I chose this example. We've been at this now a few years in different ways since '07, but again, this was one that I thought you might be interested in because it was before, as I said, there was that fee code and a lot of really great resources that are available now. So we did have a look sort of before and after, and we had a look to see who was completing the RORCs and number of referrals and all that kind of stuff. So we were quite pleased with the outcomes for the period of time that the public health nurse was involved, knowing that this wasn't sustainable, but knowing that if we could get in there and really get things going and then do some check-ins later, that it would work. So you can see there that we saw that the RORCs were being completed on the records, that the NIPASings were being done and attached to the charts. There were a few visits that didn't have the NIPASing on the chart, but so we also did a telephone survey with parents, and you can see there that they generally remembered reviewing the NIPASing. Certainly they recalled hearing about community resources, so that was very good for us. 38% of them had already used the OEYC when they got there, so we thought that was pretty good, and a further 24 reported going after the visit. That was one of the sort of universal prescriptions that we asked physicians to really encourage, read to your child, hold your child, and visit the OEYC, the library, all that kind of stuff. So parents loved it, as I said. We got some good information about what they were looking for in terms of next time I come, tell me it's going to be a little longer, I'll leave my older child at home. Stuff, really practical stuff like that. So it was a very good project. And we also did some focus groups with the primary care providers that was really helpful in terms of going forward and doing further projects in the community. So I was going to mention beagreatparent.ca, so that's all I'm going to say. Google it, beagreatparent.ca, because that's the other example that I was thinking about using, but I'm going to stop there in the interest of time. Sure, yeah. The other website that I want to just say to write down is machealth.ca, and that's the 18-month portal that's now available. If you Google 18-month well baby strategy or machealth.ca, there's a ton of resources on there now that are really helpful. I should have had them on the slide. Sorry.
I don't have a PowerPoint presentation, but I do love being the last speaker on the last panel in between you and the wine. That's a good feeling. My name is Catherine Fife, and I am president of the Ontario Public School Boards Association. I'm a trustee from the Waterloo Region District School Board. We represent 70% of the students that are in schools in the province of Ontario, and we've never been part of this institute, the Summer Institute. And I think that it's a really good sign that education is here because we are moving finally into the 21st century. And education and childcare are married somewhat awkwardly right now, but I'm hoping for a positive relationship down the road. Today's session, when I looked at what was asked of me as a representative of school boards, I thought, a lot of you wouldn't know what we've been going through, really, this year, in year one of the full-day kindergarten model. And the theme of it was leadership, and so I wanted to give you a sense of what we've been going through, what some of our challenges have been, what some of our challenges still remain, and how we're trying to navigate through a very complex rollout of the full-day kindergarten program with the extended day component, hopefully working towards that, Charles Pascal's goal of, a seamless day for children, supports for families, schools as recognized hubs in the community for resources, for public health resources, for mental health resources. And so the potential is there, so I am encouraged that we are making some progress. It has required this new conversation, a great deal of collaboration. And what school boards and what OPSPA has been doing is that we have been a member of the Ministry of Education's Early Learning and Implementation Advisory Group, so bringing the right people together. And I think that's what we learned from PEI over this year. That's a shared theme, is that communicate, communicate, communicate. Even if you don't understand what the language is, get people in the same room. As well as we've been participating on the special needs reference group, because this is one of the areas of concern that we see going forward. We have also been part of the ministry consultation process for content leading to proposed bills and regulations. And for those of you who follow all of the early learning memos, I think that there have been almost 15 of them this year. So prior to every one of those, how many? 17? Well, who's counting, right? But prior to all of those regulations, we've been trying to get to those regulations and that policy before it rolls out to the school boards. School boards plan sites by working collaboratively with their coterminous boards, another good step, right? Local best start networks, you remember those. The consolidated municipal service managers, so conversations that might not have been happening are happening now in a very formalized way, and the district social services administration. School boards also, for the first time for some of us had very good working relationships with childcare operators and with the childcare, field, but we took into consideration the impact on existing childcare and early year programs, including those operating on school premises. About 50% of the childcare in the province of Ontario is in schools. And so when the full-day kindergarten rolled out with the promise of extended day, there was a general feeling of destabilization because the space in schools, those relationships, there was a lot of unknowns as to how the status quo would change, how would we adapt, and what would the negative or positive impact for childcare be. That said, education as a whole, we wholeheartedly supported the rollout of the full-day kindergarten. We do recognize that extending those early learning opportunities for children will, work towards our goals around student achievement, around equity and inclusion, poverty reduction, and it basically is just an extension of just good education practices, especially when we were encouraged around the play-based curriculum. That was what we heard as trustees. The concern that these children were they were too young to attend school full time, and what were we doing and institutionalizing children. Some of you in the childcare have heard of that before. Some of that negative feedback. The early learning program has drawn a great deal of attention from stakeholders in the education sector, and it is without a doubt one of the most complex initiatives to affect school boards in quite some time. And the program involves practically every aspect of our work in education, from transportation to capital planning to training new staff. And so I think, in theory, when it rolled out, it was this big, beautiful, vision. And then once that vision hit the ground, some of the wheels fell off in that first year because the extended day component in particular, there was resistance to school boards delivering childcare services, taking ownership for that, especially when we did have, very good working relationships with childcare providers, who we've learned don't like being called third-party providers. So, even language is important at the end of the day. But we did lobby for flexibility because we do feel that if we do have strong working relationships with childcare providers in our schools, that those relationships shouldn't necessarily be interrupted. And we were successful in lobbying for flexibility. That said, the option for school boards to still operate the extended day, the before and after component is there, but there are some on-the-ground challenges to make that vision actually a reality. So the extended day has not been, I think, the uptake on the extended day has not been what people wanted or expected. This is the year one of full-day kindergarten, only 5 boards in the province delivered the extended day, 5 public boards. And some of those were because they took it upon themselves to try and lower the cost. So this year going forward for year 2, thus far we only know of 2 school boards that will be delivering the extended day component. So, that seamless day component of the full day kindergarten model is actually not on the ground happening. So why isn't it? Some of the reasons I've said, there was definitely a communication challenge going forward, which we're getting slowly we're getting better at. The fees and the costs, the cost for the extended day before and after component is cost prohibitive, with school boards charging almost everything from the low boards that are successful $15 a day to all the way up to $32 a day for the before and after component. So obviously, parents who are struggling day to day can't access that. And we've learned while we've gone through this process that there's a reluctance to apply for subsidy. So that's something that we continue to work on. So fees do need to be affordable for parents and similar to the fees that coterminous school boards and to those that unto our other child care providers. So there has to be consistency if you're looking to make the extended day and the seamless day a successful project. We've also seen some challenges with students with special needs and transitioning from either a Kids Ability or a Community Care Access program into the school system. That has not gone as smoothly as we wanted it to, so we're working with the ministry on that. And going forward, we looked at the opportunity from a curriculum perspective in looking at the kindergarten curriculum. How can we make it more inclusive? How can we make it better? What are we hearing from our communities to make it stronger? And from that perspective, we recommend that as the curriculum and the program documents are developed and fine-tuned for full-day early learning, it includes First Nations, Métis, and Inuit perspective that support identified development, particularly through language and culturally relevant materials. So we've moved into other areas of conversation from a perspective of, our role. We've repositioned ourselves in education to have a more broader conversation around childcare. What's encouraging for me is that we're not having the discussion of, why are we talking about childcare anymore? So we're not back there. We're here, but we're still in that process of learning about childcare priorities and about the benefit, and we're in the process of educating our fellow boards. So I hope that I've given you some perspective. And finally, someone give me some water.
Oh, sorry. I was just sitting right here doing that.
I know, and aren't you public health? You should recognize that.
If you choke, I might do something.
I'm almost done. Essentially, you may be discouraged by some of the things that I say, but it's a long journey. Today the government announced their year 4 and year 5 sites. So your communities are going to know where they're going to have full-day kindergarten in 2014-15, which quite honestly is a smart thing to do because parents want it. Once they got over the fear of, a long day, and once their kids came back and they were encouraged, and we as school boards have seen very real and tangible successes, especially from a literacy perspective, the social interaction. This is really an ambitious and innovative program that needs to be continued. We need to continue to work together and have these conversations, learn from each other, learn from PEI in Manitoba. We dream about Quebec, but that's another story. And support our children in our communities, support our parents, and have an ambitious conversation for education. Thanks very much.
Thank you very much to all three panelists for giving us your perspectives. Certainly we all know, I think, that the implementation and success of moving from what we have now to a real system of early childhood, a real system for children and families from 0 to 12, absolutely rests on the shoulders of Children's Services, Public Health, and school boards. They are the leadership from those, from local leadership from those groups is an absolute prerequisite to any kind of success as we go forward. And I think it was valuable to see how you each came at this and what you each had to say. I also noticed a lot of overlap of goals, overlap of visions, and some overlap of activities in going forward. Yes, you're absolutely right, Catherine. It is unique, and we're moving forward to get school boards in here and vice versa, and to bring public health in as is also part of the ground and part of the foundation we need to move on. So I think we are moving in that direction, but we all need to keep talking together.